Welcome to Health Watch on ATMC TV, presented by Novant Health. I'm your host, June Baker. On this month's show, we'll meet with Dr. Mark Tillotson of Brunswick Surgical Associates, Dr. Lee Hsu of Brunswick Women's Center, and Kelly Griggs, Manager of Women's Services at Brunswick Novant Medical Center. Dr. Tillotson will share with us details about Relay for Life, of which he is co-chair this year. In addition, he will discuss some of the various surgical procedures and treatments to combat cancer. Dr. Lee Hsu and Kelly Griggs together will share with us what's new and what to expect at the new Novant Medical Center Women's Services Unit. Stay with us for the next half hour as we bring you Health Watch. Let's first welcome Dr. Mark Tillotson. Dr. Tillotson, welcome to the show today.
Thank you.
Now, I know it's been a long time since you've been with us on the show, and so for our viewers out there who didn't catch the last segment with you, tell us a little bit about you.
Well, I've been practicing. I've been a practicing surgeon for about 18 years. Mm-hmm. I actually trained at the University of Texas, did my medical school there in San Antonio, and then moved out to the coast and, well, actually did my surgery training at UNC in Chapel Hill. Mm-hmm. And from that area there, my family decided that they liked living by the coast. And so the next thing I ended up in New Hanover, and I worked there for about 8 years, mm-hmm. and then came down to the Brunswick area.
Wow. And did you grow up in Texas?
No, actually we moved around quite a bit, but I ended up finishing high school in Texas.
I see. Lovely place.
Mm-hmm.
Well, how long now have you been in Brunswick County?
I've been here about 11 years now, June.
Wow. I know that your practice is called Brunswick Surgical Associates, and I believe there are 3 practitioners, including yourself. Is that correct?
Yes, that's right. There's myself, there's Dr. Richard DeSandre, mm-hmm. and then Dr. Rich Scallion.
Dr. Rich Scallion. What kinds of surgeries or procedures do you do at Brunswick Surgical Associates?
Well, quite a few. And you know, it's interesting because the concept of general surgery,
right.
when you hear about a lot of subspecialists, we really do a tremendous amount of surgeries. Mm-hmm. We do, it turns out we do, at least 90% of the cancer surgery that's done in Brunswick County.
Really?
Mm-hmm. We do cancer surgery for everything from thyroid cancer, breast cancer, any kind of colon, stomach cancer, and soft tissue cancers. So we do quite a bit of what we call general surgery. We also do advanced laparoscopic surgery, mm-hmm. which is minimally invasive surgery for a number of procedures. I myself also do vascular surgery, which means we do bypass grafts for people who are having trouble with the blood flow to legs, or blockages in such things as the carotid arteries, which are the arteries in the neck. Mm-hmm. So we do, I think we pretty much cover the gambit for a variety of surgeries.
Mm-hmm. And you do all of those surgeries at Brunswick Novant Medical Center?
Yes, we do. Just about all of them are done there. They have an excellent facility there, so it works out very well for us.
Mm-hmm. It is a really nice new facility. Now, I know you have an office in Supply, but I believe you have another location. Can you tell us where that is?
Yes, we have. I don't know the exact address, but it's at Sunset Beach. Mm-hmm. I know how to get there. You go down 17, turn on 409 at the McDonald's, and take another right down by I think it's the Food Lion. But basically, it's down in Sunset Beach.
I think it's the Sea Trail Medical Center.
Yes,
is that correct?
Yes, Sea Trail Medical Center across from the Sea Trail area. Mm-hmm. And we're there currently 2 days a week, so we're down there on Wednesdays and Thursdays.
Mm-hmm. So both offices are open every week, mm-hmm. But just sort of different days. Mm-hmm. And the 3 of you, do you rotate between the 2 offices?
Well, currently just myself and Dr. DeSandre rotate between the 2 offices.
I see.
Dr. Scallion is only at the supply office for now, and the supply office is open 5 days a week.
5 days a week?
Mm-hmm.
Oh, good. Now, I know that you wanted to talk about Relay for Life today, and I believe that's coming up in May. Is that correct?
Yes, coming up May 4th. Mm-hmm. I think it starts at 6 p.m., but it's an all-night event, so You can
Now
bring your
that's
tent.
all night, like Friday night?
Yeah, Friday night through Saturday morning.
Uh-huh.
So feel free, June, to come and camp out.
Thanks.
But it's really a very impressive thing if you haven't been before. And I think one of the things that's really exciting to me about it is that the people that are involved, they do such an important job making sure that people realize that if you've had cancer and you've had to live through cancer, you can still live a full life and have a great life and really cherish and enjoy what you're doing. And I get a lot of inspiration from them.
Oh, I bet. It sounds wonderful. Now, where is it held?
It's held at West Brunswick High School.
West
It's on the
Brunswick.
grounds over there.
Uh-huh. And I think I heard a rumor that you might be a co-chairperson?
Well, yeah, they asked me to be an honorary co-chairperson, which I was
Wow,
very
how
honored
cool
to
is
do.
that?
Yeah, it was very nice. And it's myself, Joe Stanley, and then Betty West are the three honorary co-chair people. And there's three people that I think are the organizers that are sponsoring it: Dee Carlisle, Melissa Yao, and also Alicia Sides.
And they're sponsoring?
They're sponsoring. They're already raising money.
Wow.
But it's I don't know if people realize it, but the Relay for Life was actually started by a physician out in California who decided he was going to go around a track a number of times and raise money. And that just sort of caught on. And really, I think the lay people do more than us physicians, I'm afraid to say. So it's nice to get back involved in it and raise money for a good cause.
Now, will the folks that are walking in it, do they solicit donations and then walk and in support of those who are suffering from cancer? And
Some solicit donations, and others have things that they'll sell for donations. They'll make products. So there's a variety of things that they'll do. There's what they call luminaries, which are bags with lights in them that you can place out on the track in memory of people that have had cancer, either have done well or not done well. And so there's a lot of ways that they go to raise money.
well, that sounds like a really worthwhile project, and you sound like you're very enthused and happy to be part of that. So congratulations on being one of the co-chairpersons.
Well, yeah, thank you. It is really nice because I tell you, I can't stress how neat it is to see somebody who's gone through something like that
Right.
and really come through the other end, and they're ready to help other people. And that's the most amazing things. Many of these people that are involved are cancer survivors themselves. And as you know, probably everybody has either somebody in their family or just one generation away that has had to deal with cancer.
Yeah. Let's now welcome Dr. Lee Hsu and Kelly Griggs. Well, welcome, ladies. Welcome to our show. And it's so happy to have both of you here.
Thank you.
Dr. Hsu, I'd like to start with you. It's certainly a pleasure to meet you, and I'd like to get to know you a little better. Tell me about yourself, and I understand you're at Brunswick Women's Center. Is that correct?
Yes, and I recently joined the Brunswick Women's Center, and that's actually only a month.
Oh, you really new.
Yeah, brand new.
Uh-huh. Well, tell me, how long have you been here in the area?
I moved down here for about half a year because my husband, he's a physician too, and he found a job at Wilmington, and that's why we moved the whole families here. And I worked at North Indiana for 3 years. I think it's good to have a change of climate, get to the warmer place.
Yeah. Tell me about your schooling, where you went to school and where you did your residency.
All right. I finished my medical school in China. And after that, I got a scholarship offer from University of Houston to do a Master of Science. I was young, and I want to see the world, so I just didn't hesitate and accepted.
Oh, sure.
And got a master, and then did a few years research. And I was in Cleveland Clinic for a couple of years, and in Columbia University for a couple of years. And when I was doing my research, I took my medical board, and after that, I just got my residency training in New Jersey.
In New Jersey?
Yes.
Wow, that's a lot of training there, a lot of
I
education.
know, many years of schooling. Yeah.
Well, that's great. So Kelly, tell me about yourself. Where did you do your training, and how long have you been a nurse?
Absolutely. Well, I'm fairly new to Brunswick County myself. I just started in the nurse manager role at Brunswick Novant Medical Center as their nurse manager of women's services in January, at the end of January, so still very new here.
You both are the new kids on the
block,
right?
We're the new kids on the block, that's correct. So I have been a registered nurse since 2005. Prior to being a registered nurse, I worked in the insurance industry. I worked for a small HMO called Partners National Health Plans, and then Blue Cross Blue Shield of North Carolina, and I worked as a sales representative and also as an account manager.
Wow.
And decided to make a drastic change. Had always wanted to be a registered nurse and went back to school to fulfill that. Yes.
That's awesome.
Very supportive family, supportive husband, supportive children. So I completed my associate's degree at Forsyth Technical Community College, went on to complete my bachelor's degree at Gardner-Webb University, and I'll graduate with my master's degree in August.
Wow.
In nurse education. And so very excited about that. Have always worked in labor and delivery or within the scope of women's health nursing. Have a tremendous passion for it. I am certified as an OB nurse and enjoy being able to serve the community here.
So you said you're the manager of the Women's Services Unit at Brunswick Novant Medical Center?
Yes.
Prior to coming here, were you at another facility where you had that position?
I was at Forsyth Medical Center in Winston-Salem, North Carolina, which is also part of the Novant Health system.
Oh, so it's a related facility.
It is. It's a sister facility. I worked in labor and delivery as an assistant nurse manager in that facility, and was blessed to have the opportunity to come here and advance my career.
Well, that's great. Both of you have such interesting backgrounds and tons of education, especially between the two of you. Well, we're pleased that you're here, and I know that you bring a wealth of education and training to our new moms and our female patients here in Brunswick County. So as I understand it, you're both very connected to the New Brunswick Novant Medical Center and probably work very closely together with on the unit, on the women's unit. And I was wondering if you could talk to me a little bit about the relationship between the physician staff and the nursing staff and how that, how you come together to care for our patients.
Absolutely. We have a very strong partnership with our physicians, and we work very strongly together to make sure that we are meeting the needs of our clients and the needs of the community.
That's a wonderful philosophy, I think, that it is a partnership. And I know that both of you are very new to the hospital. Dr. Hsu, tell me what the reaction has been to the new unit with your patients and your new moms. What have they said about the unit?
Well, everybody loved it. Yeah, I had numerous patients come to the hospital just because of the labor delivery unit. They said, you know, they had relatives coming here delivery. They really love the labor delivery room. It's so spacious, and I really impressed. You know, they really take the comfort of the patient's relative in mind when they design the room. Yeah.
And from a patient perspective, is it a friendly environment for you to work in, and is it an easy environment to deliver babies? And
yes, and the nurse is, you know, trying to help in every way they can, and you know, the unit is very accessible, and I just love the whole design of the unit.
Well, good. Yeah. I'm glad to hear that.
We've really tried to make it into a family center, which means that from the moment that a pregnant client enters the door and their family members, that they feel welcome and they feel very warm in that environment. And that's from the point that they come in laboring, or whether they're even just there for an observation, to the point that they're discharged home, that they have that total package, that total care package.